I mean, this is something that I talk about with every patient who comes in for a skin check. So there are two types of skin cancers. There's melanoma skin cancers and there's non-melanoma. Now, the melanoma skin cancer are the ones where we talk about the ABCs, right? Those are the big scary ones where your moles are changing before your eyes, right? You have asymmetry, you have irregular borders, it's not a nice clean round mole, it has multiple colors. The D is for diameter, where it's bigger than the size of a pencil eraser, and E is for evolving, so it's changing. So if you're seeing a mole actively change in front of your eyes and it's bleeding and it's painful, those are warning signs. You definitely should get that checked.
Welcome to the CareMedica Elite Podcast. On today's episode, we sit down with Dr. Leena Ramani, board-certified dermatologist and expert in hair restoration.
All right, hello everyone, and welcome to the CareMedica Elite Wellbeing Podcast. My name is Paolo Persichetti, and I am the Director of Lifestyle at CareMedica Elite. So today we're going to be exploring something that is exciting and rapidly evolving field, which is the new frontier of dermatology and hair restoration.
Yes.
So to help us navigate this field, today we have Dr. Leena Ramani. She's here.
Thank you.
Thank you so much for coming. We welcome you to CareMedica Elite. You are a board-certified dermatologist and expert in aesthetic medicine. So thank you so much. Tell us a little bit about yourself.
So I am a board-certified dermatologist. I'm also a fellowship-trained hair transplant surgeon. So dermatology and hair loss is my passion. A little bit about me. I grew up here in South Florida, right here in Palm Beach Gardens. This is home. I spent about 10 years up in Pennsylvania, completing all of my schooling. I went there for college, medical school, residency. And it was nice, but I definitely got a little bit tired of the cold weather and the snow, so I knew I had to find my way back home. And now that I'm back, I have decided to open my own dermatology practice and give back my care to the community.
So skin health, longevity, and confidence. Okay, we hear a lot about this.
Mm-hmm.
Longevity. Everybody's talking about longevity today,
medicine,
right?
Yes.
So everybody's talking about aging and this and that. So how is your field? How does your field help people, or what they're trying to achieve when they come to you?
Well, I think the primary thing that they're coming, the primary thing they're trying to achieve when they come to see me, one, is to make sure that their skin is as healthy as possible. And here in Florida, the most important thing is making sure that they don't have something like skin cancer. So, of course, coming in for skin screenings is very important on a regular schedule to make sure if there's anything, we're catching it early. If we're seeing signs of precancer or early types of sun damage, there are treatments that we can start ahead of time to help mitigate that damage, prevent further progression of different things. So I think that is ultimately the most important thing. And then the next concern that people will look for are those signs of aging, the changes in their skin that comes with time.
What kind of testing? What kind of tests, for example, they will take to detect, for example, early signs of skin cancer or something like that? There are specific tests that, for example, they do, whether there's a lighting or something. What kind of tests do you do to?
Not necessarily tests, but on exam, if we're seeing more of actinic keratoses, those, what we call precancers, then it signals to us. This would be something that is like a rough, scaly little spot on the face or the back of the arms, or
They look like a little pimples or something like that.
They don't look like pimples, but they're these rough, scaly spots, and they come and they go. Sometimes you can exfoliate them and they'll go away, but then they'll come back. That's always the typical
type of an irritation or something in the skin something?
It's a sign that the DNA has been damaged. So the skin cells are not necessarily growing or exfoliating or turning over as they should normally. So they'll get this type of scaliness on the top. And so we'll see them. Sometimes people will just have one and we treat it and we know.
And how will you treat those? How will you treat it?
There's many different treatments. So if there's only a few, sometimes the body itself does have the ability to recognize that this skin is damaged, and it will try to attack it and treat it on itself. But sometimes when you have larger, thicker ones, it does warrant more treatment. So we can either destroy them with liquid nitrogen. So
Okay.
that is a treatment that uses a very cold spray, minus 200 degrees Celsius, to
Okay.
kill the top layer of the skin cells. The growth will fall off, and then your new skin will grow underneath. And that's okay when you have a few here and there, but once you start to have more, that's when we really do worry about, one, progression of some of these things into true skin cancers, but also it's just signs that you've had a lot of sun exposure, so we want to be more preventative. Then we do things like chemotherapy creams or chemical peels even.
So in this case, for example, because this was one of the questions that some of those elite patients left questions.
Oh, perfect.
Right? This is what it says. Many people invest in fitness,
And fitness,
nutrition, and wellness. Why should skincare be considered part of an overall health strategy? Interesting. Well, you just said it, but
That's a good question. A lot of skin health does reflect what is happening internally. So yes, fitness is a big part of that. Your diet, your nutrition, your lifestyle all plays an impact on how your skin looks. It really does. People who are eating clean, eating, vegetables, vitamins, it shows in their overall appearance. But there are external factors that are at play too when it comes to the skin, because our skin is what's protecting us from the outside world. So things like sun damage, pollution, outside oxidative stress is still considerably affecting our skin. So that's where skincare comes into play, because that is what's very important in preventing those, protecting against
excellent.
those.
So actually the skin is the first protection against
Right?
the exterior,
It's the
right?
largest organ in the body.
There we go. Okay, I have another great question here. So how much does healthy skin and hair impact confidence, mental well-being, excellent question, and even professional success?
I think it impacts it immensely. I have patients coming in every day concerned about what's happening to their hair, what's happening to their skin, affects them emotionally. And then a lot of people, especially patients who are in these high profile occupations, they are very fixated on their appearance and what their appearance portrays in their field.
Okay, if I can add something to this.
Yes.
What I see, for example, when I go to the gym or something like that, right? So, men do have a feeling with the hair.
Yes, they do.
It's becoming. It's becoming
a little bit more talked about. I think before a lot of people were noticing it, but they weren't as vocal about what they were doing to treat it or how they felt about it. But I think people are now recognizing that there's more that they can do. So they're willing to come in and talk about it more.
What are some of the earliest signs of aging that people tend to overlook?
That's a good question.
Well, that's mine.
Oh, okay.
I did write it down because I didn't want to remember. So I wanted to remember this question. Some people overlook stuff, right?
Yeah.
And they have signs, but maybe they don't know how to recognize them.
I think, especially with hair, I think noticing feeling like you're shedding a little bit more, but you're not necessarily seeing visible loss on the scalp, that's an early sign. And people usually wait too late. They wait until they actually can see their scalp underneath their hair, and at that point you've lost about 50% of your hair once it's more noticeable to somebody else.
Oh, okay.
Yes. So the earlier you start to any type of treatment, the better your result.
So, and what are, for example, what are the treatments? What is something that you can actually do to
help restore the hair? Of course. So I think of treatments, there's in almost 3 different buckets. Of course, there's medications, there's this newer field of what is called regenerative medicine,
Okay.
and then there are treatments and procedures that we can do. So in terms of medications, there's the classic minoxidil and then finasteride, treatments that are designed to help keep the hair in the growth phase longer, that are designed to help block the hormonal factors, the cause of things like male and female pattern hair loss. So those are more medications.
Okay.
And then in regenerative medicine, we have things like supplements, nutritional supplements, vitamins that are specific to hair. And then we have peptides and exosomes, the newer stem cell types of treatments.
So, talking about the peptides, a lot of patients today are because they are overweight or they have problem with insulin or insulin resistance or whatever, and they are on the GLPs, right?
Right.
And one of the contraindications actually of the new drugs, Ozempic, tirzepatide, all of this, could be hair loss.
Yes.
In your with your expertise, let's say a supplement, incorporating supplements to the diet is something that is enough in the initial stages or not necessarily?
It depends. So everybody's degree of hair loss that they'll experience with a medication like Ozempic varies. It depends on how strong they have their genetics are in terms of them having hair loss later in life. It depends on how much weight they lose, how fast they lose the weight, what their diet looks like while they're on these medications. It's always really important if you're on one of these GLP-1s that you have a very high protein diet.
So a good protein diet could help?
Yes.
And sometimes they don't take enough protein, and doing the GLP-1s are damaging actually.
Exactly.
Or
we see it in the muscles loss as well, right?
Yes,
so,
sarcopenia, correct.
That's important. And then micronutrients are really important. The things like zinc and copper and selenium. Those are vitamins.
Copper and selenium, yes.
Yeah.
Excellent. I'm going to take some notes of this.
Okay.
All right. So I have another question over here. One of our lead patients. So hair loss affects both men and women.
Yes.
And we know that. What are the biggest misconceptions you hear about hair restoration?
About hair. I think the biggest misconception is that people think they can just wait until they've lost enough hair, have a hair transplant surgery done, and then that'll be the end of it. They'll have their hair back and they'll look great. And unfortunately, that's just not the case. Hair loss is a condition, it's a disease, and it's progressive. And we just don't know at what rate. Everybody has a different rate of loss. And so all these medications, all these treatments that we're doing are designed to prevent that progression. And unfortunately, we don't have anything that's a one and done cure. I think people underestimate how much maintenance is required to help maintain healthy hair, thick hair.
Wow, okay, very good. So basically prevention.
Yeah, I mean, that's the key with everything, right?
Early prevention is the key for everything. What kind of, I know we cannot go into maybe a lot of technical details, but what is like the first test that you do in a man or a woman to see how how healthy the scalp or the hair, or how do you measure the hair loss? I mean, in a sense, like if I will come to you tomorrow morning and says, listen, check my hair or check me out, whatever, what will you do?
So as a dermatologist, well trained in the art of dermoscopy or trichoscopy, so what we have is like a magnifying glass, but it has a special filter, a polarized filter, and we use it for everything in derm. It's what we use to check your moles and in certain rashes, but we'll use that to examine the hairs on your scalp. And what we're looking for is there any signs, is the follicle still, is the pore still viable? And then how many hairs are coming out of each follicle? What is the size of each follicle relative to the other ones around it? Because what we see over time with hair loss is out of one pore in a younger, strong scalp, you have maybe 3-4 hairs coming out. And gradually over time, the hair follicle itself, the size of the follicle shrinks over time, the diameter. And so that affects density. And then over time, instead of having 4 hairs coming out, you have 3, maybe 2, maybe 1, and eventually they continue to shrink in size until they fall out. So when I'm looking with trichoscopy, I'm looking to see how strong are the follicular units. And then kind of comparing the strength on the top of the scalp to the areas in the back where we say hair is more resistant to loss.
Okay, got it.
And it's the same for women too.
Same for women. So what options are available today for patients who aren't ready for surgery? Well, I think you said it before.
Yeah, we have, of course, there's medication options, but now in 2026, we have a lot of other natural and non-medication options that if somebody is just contraindicated to take in medications, we at least have other options. That's including, the supplements, topical peptides that they can apply at home, red light therapy, red light hats. And then we have things like PRP and
which are like some of the peptides that you can apply?
Yes, so there are products that have been combined into peptides. So the one that I recommend is from Extresse, and what they do is they have small oligo chain peptides. So it's a smaller size, so it's more easily absorbed into the scalp. Okay. And then they use copper peptides and then BP.
Is that like a shampoo or something? I
mean, no, it's a topical.
Oh, it's a topical.
Yeah.
Okay.
So you can do it once a day, after you get out of the shower or at nighttime before you go to sleep. You just apply it. And the nice thing is it's not oily or greasy, so it gets applied, it absorbs in, and it doesn't weigh your hair down.
Got you. Okay, I have a good question here, I think. Are you seeing younger patients becoming proactive about their hair prevention?
Absolutely. Yes, a lot of men are coming in their 20s, early 30s. They've seen what's happened with their fathers or brothers, and they want to do everything they can to prevent, and they want to save themselves a trip overseas to have surgery done.
Got it. So that, so the trend is like, I want to look like refresh, maybe not different. We want to have that natural look, and men or women again. Actually, I feel
everyone.
A lot of women today are suffering from hair loss, right?
Yeah. So that's another misconception.
Not more than before.
I don't think it's more than before, but
maybe
I would say it's more talked about.
Okay.
Before, the assumption was that only men had hair loss because men would go bald, and it was more acceptable.
Okay.
But a lot of women do experience hair loss. About 50% of women over the age of 50 will experience hair loss.
Wow.
That's a significant number. But I think nowadays maybe it's more because more people are going on to GLP-1s, more people are getting hormone replacement therapy.
Maybe social media is helping out a little bit?
Of course.
Social media is
awareness.
Yes, the revolution of everything, actually.
Yes.
Yeah. So, good question here coming up. So, Florida has some of the highest sun exposures in the country. Okay,
yes.
What are the biggest mistakes people make when it comes to sun protection?
I think one of the biggest ones living here in Florida is people thinking that they're not exposed to the sun just because they didn't go to the beach that day. I think, here, even just getting out of your car, walking to the Publix parking lot, or going out to get to your mail, the sun exposure here is just so much higher. All of that cumulative exposure over time plays a bigger role than you think.
Okay, and the sun is not as healthy as it used to be, so the ozone
layer
is
the ozone layer is
thin,
thinning,
blah, blah,
more UV getting through.
Okay, so what warning signs of skin cancer should people never ignore?
Okay, so this is what I say to my patients.
This sounds like an interrogatory, but it's not.
This is something that I talk about with every patient who comes in for a skin check. So there are two types of skin cancers. There's melanoma skin cancers and there's non-melanoma. Now, the melanoma skin cancer are the ones where we talk about the ABCs, right? Those are the big scary ones where your moles are changing before your eyes, right? You have asymmetry, you have irregular borders, it's not a nice clean round mole, it has multiple colors. The D is for diameter, where it's bigger than the size of a pencil eraser, and E is for evolving, so it's changing. So if you're seeing a mole actively change in front of your eyes and it's bleeding and it's painful, those are warning signs. You definitely should get that checked. But in Florida, or in general, actually, the most common type of skin cancer is called a non-melanoma skin cancer. And so those are like basal cells and squamous cells, which are the most common types. Now, those don't present the same way as melanoma, but they're more common. So what I always say to my patients is what you're looking for is a pimple on the face, or it looks like a pimple, everyone calls it that, but then it's not going away. Like a pimple should normally go away. Or it's there and it will randomly bleed, or every time you just lightly touch it, it bleeds, or it's painful. Things that are just not typical. Those are the most common signs of a basal cell, especially on the face. And then the other kind, or like a big growth, like a rough growth essentially that kind of comes up, would be more concerning for a squamous cell. But the other thing to watch for is if you get a cut or a scrape on your arm or your leg and it doesn't heal, that's signs of a skin cancer.
Wow, okay. Okay, so how often should adults have, a professional skin examination?
So there are no official guidelines as to how often somebody should go, but it all depends on your risk factors. So certain questions that I ask every time somebody comes in is, have you ever used a tanning bed before? because even having used a tanning bed once in your lifetime significantly raises your risk of ever developing a melanoma.
Oh my God.
Yes.
I
And a lot of people don't realize that, and a lot of people have done tanning beds maybe once or
forever.
twice in their teens, or some people have been going to them more regularly.
the people that do it today frequently.
And people still do it today, and they still, I mean, at this point today, they're ignoring the risk, but...
But the point was that they were not, there were no harm on doing the, on doing this bed.
No, the tanning beds are much more harmful because you're getting a much higher dose of that UV radiation at once.
Wow.
Yeah, spray tans are fine. Those are just, they're spraying you with color, but the tanning beds are bad. So if somebody tells me that they've done it, I will absolutely make sure that they're coming in every year for a skin check.
Wow, this is something, I think we touched something that is really important here, because, for example, I didn't know, and I didn't know, and many people probably are not going to know that.
Yeah.
And that's crazy.
A lot of people haven't realized. And then the other thing are blistering sunburns. If you've ever had one blistering sunburn in your life, raises your risk of ever developing a basal cell carcinoma. So that's like another factor that I'll add in. And then in your family history, if somebody in the family has had melanomas or multiple skin cancers, or your lifestyle, if you were a lifeguard or you play golf every day.
Basically, we have to check ourselves.
Yes.
And we need to take care of this, right? Okay. If someone walked into your office today and said, I want to look and feel my best for the next 20 years, what will be the roadmap to that?
So I think a lot of it does come from your internal health. So making sure you're setting a nice, healthy lifestyle for yourself, preventative medicine, of course. That's the first thing. But then when it comes to skincare, coming up with a good skincare regimen, a good plan. If you're starting with topicals, you want to incorporate a retinoid into your regimen. Mm-hmm. That is probably the number one most studied topical medication. Every dermatologist probably uses it. It's the best for collagen production, fine line reduction, overall skin tone evening. The earlier you start, the better the results are over time. So if there's going to be one thing you start for 20 years, make it a retinoid.
Vitamin C.
Yes.
Creams with vitamin C on it and with
vitamin C is another great addition to your skincare routine. So vitamin C, the major benefits are antioxidant protection. So living in cities with all the pollution and sun exposure, it helps prevent against that. But also it does have a nice brightening effect. So it does give people a nice healthy glow.
It's been so nice talking to you, and your experience is really amazing. And we're going to get a lot of questions from this podcast.
Perfect.
And we're going to get you back again, and we're going to...
I would love to.
We're going to go through all those other questions, because I think we didn't talk enough. I mean, there's so much more that we need to, we need to talk about. Not only about, skin cancer or how to take, we not necessarily we need to be talking about skin cancer all the time. Mm-mm. We can talk about so many other things about the skin.
Yes.
Like, of course, everybody wants to look good, beautiful, and young.
Yes.
And
cosmetics.
This is what we have here, right? So what's the one skincare product everyone should have or own?
In Florida, sunscreen.
Okay, that's like Florida.
Yeah, that's a given, but it has to be, in terms of which one to use, that's a question I get a lot. So you want to make sure it's at least 30. So SPF 30 is the minimum. If you've had skin cancer, sometimes I'll say, okay, maybe go to SPF 50. Yeah. Beyond that, there's not as much of a benefit. The most important thing is making sure that you're applying enough of it. So that is, for the face, a 1/4 teaspoon amount. For the whole face, another 1/4 teaspoon or so for the neck and the ears, and then about a shot glass worth for the full body if you're at the beach or the pool.
So, this is like for myself. So when I go to the beach, usually, when I was younger, I used to play, beach volley. Yeah. So I used to do a lot of, and I never used anything on my body, which was not so good. Thank God, hopefully right now I don't have anything.
You need to come see me for a skin check.
We're going to come and see, yes, I'm going to come and see you for a skin check, absolutely, yes. But, later years I go to the beach. I enjoy being there. I go under the umbrella. Mm-hmm. I don't take the direct sun anymore.
Yes.
And I do put some, protection, whatever. But how often do you need to reapply the protection?
Yes, so you really do need to reapply it at least every 2 hours if you're at least just sitting there on the beach. If you're in the water, then you need to reapply when you come out. Those waterproof sunscreens, it depends. You have to read the label. Some say 40 minutes, while some will say 80 minutes. But again, when you go in and wash off, some of it's being removed.
Just do it. Okay.
So the reapplication really does prevent sunburns. It really prevents protection.
This last question over here, I think, is going to be an easy one, and I think we touched it already through the podcast. If you could give only one piece of advice for aging well, what would that be?
Taking care of yourself.
Okay.
And that's
and nutrition,
yourself, your health, your stress, your lifestyle. But then in terms of aging well in your skin, taking care of your skin. Having a good structured skincare routine that you're following through consistently matters more than using a random product every now and then just because somebody else told you to use it. You need to find the right routine for yourself that has products that are targeting your concerns.
So I would like to add something to this. This happens to me with many patients that come over either for nutrition or for cardiometabolic. So patients today, they tend to go online.
Yes.
And they ask ChatGPT, and now everybody knows everything. So they don't need us anymore. So basically, so they will tell you. I mean, no, not only, they will tell me, oh, no, listen, I'm going to do this, and this is what I'm going to do. And you're like, well, not necessarily, maybe, right? But the point is this. That's why you go to the doctor. You go to the doctor because she studied to do this, and she's experienced. So all the things that we read and everything we see online, whatever, not necessarily may apply to you.
Right.
This is personalized. You need to go to the doctor. You need to find out really what's the best thing for you to do. You need to have advices, right? But yes, my personal feeling is that yes, sometimes we have to deal with this. We get people that actually you tell them what to do, and they tell you, no, I'm not going to do it because I read, or my cousin or somebody told me that this is what I need to do.
I see that a lot. And
so disinformation, right?
Yeah.
So find out, but talk to the professionals.
Yeah, and then in those cases, I mean, I've had patients come to me with severe scarring types of hair loss, inflammatory scalp diseases. I'll go over a full comprehensive plan with them, and they'll go home and say, oh, well, I don't want to take medication. ChatGPT or Google said I can take this vitamin. And my response to that is, you came to see me as the expert in hair disease, in skin disease, and based on the research and my experience with clinical patients and what I know about your disease, this is the best treatment.
This is what you should do.
This is what I recommend. But again, it's ultimately up to you to decide what you want to do.
Well, yes, I agree with you. Not 100, more than 100%.
It's shared decision making, right?
But thank you so much for being here today. It's been really great. We're gonna do it again, and it's gonna be great. So,
thank you for having me.
Thank you so much.
All right. Are you interested in learning more about skin and hair restoration? You can find Dr. Ramani online at www.palmbeachskinhair.com. If you are a member of CareMedica Elite, you can easily schedule a consultation appointment with Dr. Ramani by reaching out to your clinical concierge today. We'd be happy to assist you in facilitating a consultation.